We're going to have lunch soon, and we can continue this sort of engagement and talking. So we're going to do, the next section is really thinking about our updates from AGMHI and the working groups. For many of you who have come in past years, the working groups are really around the 4 pillars of AGMHI. So thinking about research, training and education, clinical care delivery, and advocacy. We have co-chairs for each of those work groups. And one of the co-chairs will be presenting today and really providing us updates on what they have been doing. They meet quarterly. They serve a 1-year term, our co-chairs. Some have probably done that a little bit longer than a year, but we hope that what they discuss today will invigorate each of you to want to sign up to be a part of a work group. If you want to be a part of a work group, there's 2 ways to think about that today. One is that where you checked in, there's a sign-up form there, or 2, in your booklet at the bottom of each page is the AGMHI email address, and you're more than welcome just to email and say that you're interested in a particular working group, and we can add you to that listserv so that you can join those meetings. So we encourage you to do that. That really helps us continue the work we're doing for AGMHI. We need new voices at the table all the time. Like LaKoya mentioned earlier too, we need young people to be a part of those work groups to really invigorate the work groups and get us moving in the right direction. So I'll start with the research work group. Dr. Asmal and Dr. Munia are co-chairs, but Dr. Asmal will be presenting today.
Okay, hello everyone. It was going to be Munya, but he's the main chair, and he said as the main chair, I'm supposed to delegate. So I was like, well, that's excellent leadership, Munya. Okay, so here we go. So this is forward, right. This is our kind of active work group members. We're always keen to have more in, and it's really a wonderful team. The objectives of the research work group is the first one is to implement a mentorship program for African mental health researchers, and that was kind of started about 2 years ago. So the development of the framework of the mentorship program started about 2 years ago, and the past year has been kind of like crystallizing the program and implementing it. Our next objective was around creating a sustainable research project that could straddle a few countries within Africa, and finally to create a research space, a safe space to share ideas and to network. So I'd like to talk for a minute or 2 on the research mentorship program that was piloted in May this year in terms of kind of putting together the final framework and to get our team together. So the oversight of the mentorship program is from myself as director, and Fadwa Patel. Fadwa, would you mind standing up? So Fadwa is phenomenal. She has kind of administrated and rolled out a mentorship program at Stellenbosch University for the past 10 years, and she currently has over 100 mentor-mentee pairs under her kind of like book in her book. So she's just been fantastic. She helped guide the recruitment process and the actual kind of structure of the program. We sent out a kind of a AGMHI-wide application process, and we had 54 applicants. We kept the recruitment criteria really wide. We said if you regard yourself as early career, and I think we went with under 40, and you'd like to focus on career development, please sign up, please apply. Gave us a little bit of your CV and your goals, and we had 54 amazing applicants. I mean, honestly, I think that if we had just randomly picked 5, and that could be its own little research project, we'd randomly choose 5, we would have done an excellent job with just those 5. But the 5 that we ended up selecting are stellar. And I'd like to just take a minute to introduce them. First, Claire Kwagala. She's a psychiatrist from Uganda. Tijes Kebede. A psychiatrist and subspecialist child and adolescent psychiatrist from Ethiopia. Salamawit, a psychiatrist and public health specialist from Ethiopia as well. Yeah. Nduku Wambua. Nduku. Originally from Kenya and currently working at UKZN, finishing off her PhD. Benita Aki. From Nigeria, clinical psychologist. So welcome, really, gosh, please, they've got little minty kind of labels on their, what do you call these things, on their name badges. So, oh my gosh, this morning, Saturday morning brain. So please go up to them, chat to them. They're really wonderful people to connect with. Right. So eventually our kind of selection procedure went down deciding on people who are in a PhD track, either in a PhD or would like to go into a PhD, so there'd be some kind of cohesion amongst the group around goals. We wanted somebody who's had a couple of previous publications and who put together really strong motivation. There were lots of people that were in clinical programs already, like registrar training, and we decided against that because we just wanted them to finish their clinical training. So this is what the mentorship program looks like broadly. It has 4 slices of the pie. The first is individual mentor support. That's one-to-one meetings with a mentor, 1 to 3 hours per month, 3 hours if you're in crisis. Not every month, people. Otherwise, 30 minutes to an hour. And the goal, although, you know what they say, what happens in Vegas stays in Vegas, what happens in the meeting stays in the meeting. But the goal is, after about 6 months, you will create a draft career development plan that you can then reflect on over time. And we've got 5 great mentors that have been paired up. So all the mentees are members of the AGMHI, and all the mentors are also members of the AGMHI and are all here today. So that's the individual mentor support, and it's kind of classic mentorship that we know. The next kind of arm is peer-to-peer support. And this is why we try to get people that are very similar in their career stages. And we've got a WhatsApp group, we've got email groups, and today they're going to be having lunch together, sitting at the table together over dinner tonight, and trying to building up capacity as peers. So there's regular check-ins, quarterly meetings that we'll be having with them to just kind of see how things are going. And we're also going to be starting, and this is what I'd like your input from the audience, we'll be starting ideally a monthly masterclass where we're going to be having over, say, a lunchtime, the mentees will tackle a topic, like putting together a great poster presentation. And they will submit a poster that they put in, and we'll sit together and we'll discuss practically how to do it. And the same for CVs, bio sketches, oral presentations, whatever. So if there's any particular thing that you as a mentor, potential kind of senior clinician or researcher or person within AGMHI can contribute to a masterclass, please let me know. I think that would be super useful. The focus of the mentorship group is research, but everyone in the group is clinician. So I think we're going to do a little bit of cross-pollinating. The next aspect is online individual and group skills development, and I spoke a little bit about the individual training. The group training will involve attending workshops and seminars. We've gotten, and if you know of places that are offering workshops online, that are free, that we can link up with. So webinars on, how to write a grant proposal, or anything related to research, please let us know, and we can pass that on to our mentees. Finally, with regards to the AGMHI membership, we're looking for active contribution of the mentees of the AGMHI membership. And that includes them contributing to the quarterly newsletter, kind of doing it, taking turns, and they will be attending the congresses, and that's a really important networking opportunity. So that's kind of the overall idea of the mentorship program. And the take home is that this is a pilot. We're only doing it with 5, and we're trying to do it right, and we're trying to measure some outcomes, and we're trying to make this as interactive as possible so that we can get feedback. So then we can roll it out much bigger. And that's going to bring me to the next part of this. Just in terms of lessons learned, one of the key lessons is that early career is nice, but in Africa we need some mid-career mentorship, and we also need some foundational research skills training. So there's a lot of kind of raw talent, but a lot of people are just haven't had the training on the ground around research skills. How do we make this sustainable? How do we match the mentors to the mentees? How do we sort out technology? Because, sure. I mean, in South Africa, we've got load shedding. If you're in the middle of a rural setting, it's challenging. And people are being asked to do stuff all over the continent. So senior people in the continent are being asked to do things all the time. And so, who do we link up with whom? We're also aware that there's a skills deficit that are diverse. So what might be a strength for one person might be different for another, and how do we build that up? So this leads us to our second goal, which is a D43 grant application. So those of you who know the very painful process of a NIH grant application, we're going to try for a training grant, hopefully in the next year. And it is focusing on chronic non-communicable diseases and disorders across the lifespan. It's a Poverty International Research Training Grant. And it's really going to be kind of feeding in the idea of the research mentorship program to a much larger scale training grant. So we're going to look at a consortium model to include multiple African countries, looking at leads from keen individuals across a few countries. So, we're hoping that this grant application will benefit countries across Africa that's linked to the AGMHI, but not everyone will be co-applicants on the grant, just because institutional capacity and how you fill in the forms, etc., might be very different amongst different countries. And our focus will be on foundational learning and how we can get that foundational learning done. So right now we're drawing interest from a broad range of African partners. Just to go back on that. And so the thinking is that we're putting together this grant application, and ideally what's going to happen is within the work group, even if you're not a co-applicant in the grant, you'll be part of the learning process of how to put in a grant proposal. You'll be learning how to do a biosketch. You'll be learning about the rigor of a grant proposal. So even if your name isn't on the final application, there's a huge amount of capacity building just from that process. That's the thinking around that. And ideally, in a few years' time, we'll have a whole cohort of early career researchers that have been upskilled. Finally, in terms of a research work group, encourage everyone who's interested in research to join. At the end of every work group, we had one last week, meeting. We spend a few minutes just learning about each other's research programs and how we can share things between the different programs. and it promotes collaboration and fosters an environment where suggestions and ideas can be interchanged. Next time, hopefully, we can do a little poster presentation at the AGMHI, and you can get a bit more interaction around that. That's the plan. We'll see whether that can happen. And that's it. I hope I haven't overtook my time. The pilot is 2 years. Yeah. And check-ins along the way.
Any other questions?
Super, thanks.
It's quite impressive to, oh, sorry, one more question.
Taking it over to you, but I just wanted to find out, sorry, my name is Vincent Zishiri. I'm an international health specialist with the US Embassy in Pretoria, so under the Department of Health and Human Sciences. Services, sorry. I just wanted to find out on the matching of mentors and mentees, is this restricted to people who are part of the consortium, or is it open to other people?
The mentorship.
Yes, so matching, mentors and mentees.
So to be a mentee or to be a mentor?
The
both?
mentees have been selected, I think.
They were within the AGMHI,
Right, and then the mentors?
within the AGMHI
Okay.
as well.
All right.
So we decided to keep it in-house to begin with for the pilot, just because we felt that both the mentors and the mentees kind of understand the ethos of the AGMHI. We wanted them to not just buy into the mentor-mentee partnership, but also around capacity building more broadly.
Okay. All right. No, thanks.
Thank you, Laila. It's pretty impressive, all the work that this particular work group has done, so thanks for your leadership. Next up is training and education. This is chaired and will be presented by Mojdeh, Rohani, and Site. Mojdeh couldn't be here with us in person, and so we have a video of her providing the updates. Hopefully it works.
Good morning. Hi, everyone. My name is Ste. Thank you, Dr. Durham, for that introduction. So for this working group, Mojdeh, who is the co-chair, was unable to make it due to unforeseen circumstances, but she will be presenting, and we'll just play a video. I'm going to serve as her front for this presentation. So just so you put a face to the name, we're just going to listen to this video and watch it for a few seconds.
Hello, everyone. I'm so sorry for not being able to join you in person, and I'm sure so far you have been having a wonderful conference and hope you enjoy the rest of the sessions and activities. And I have been asked to provide a little overview about the work of the Training and Education Working Group. So I'll just go ahead and give you a quick update about what we have been focusing on during this past year. So I'll just go ahead and share my screen. If you give me 1 second, please. So I think
Slides on. Just a second.
year. And what we have been focusing on, so these are some of the members of our group, as you can see here, and I hope you get to meet some of them in person during the conference. And what we focused on this past year really our goals were to develop accessible trainings and educational tools for providers, different health providers and mental health providers, foster collaboration and secure funding for training modules, and reach diverse networks in mental health. So those were the three goals that we focused on during the year. And what we ended up doing regarding the first goal that we set was to focus on developing a trauma training module. That was the need that came across unanimously as being the most desired and needed within the different networks that our members represented. So we put together a trauma module during this past year and then discussed amongst ourselves the best way of disseminating the information, the trainings, once it's ready for dissemination. What is the best way? Do we do live webinars, 2 hours each? Do we do training series, let's say for a number of months, having 1 or 2 hour sessions? Would that be feasible, convenient for everyone to participate in? And finally, we talked about recording the webinars because now the Institute has this new website which is really includes a wealth of information and resources for all different members and groups. And we felt that it would be best, at least for the time being, to record the different trainings that we have on our module, place them on the website, and maybe for the future, maybe this is something that we will take on this next year, to have live presentations with a Q&A after a group of people have been able to watch the recorded webinars, and then we may follow up with live sessions after a certain number of people have been able to go through some of the trainings that we put online. So this is just for your information, what we came up for the training module that we put together. I will not go through everything that it's here. You can see it. Just for your information, we have been able to put together the outline for some of the trainings that you see here, and the rest are in work in progress. And the trainings that we do have recorded already is the early childhood and infancy training has been recorded, and also the one on ethics. And Dr. Apaku has done the one on ethics, and Dr. Awosu and Hughes have done the other one on early infancy and childhood. We do have the outlines for a number of other trainings, and we will be focusing on recording those in the coming year. Some of the challenges that we have faced, really it has been difficult to have members who reside in a number of different time zones, and to really find a time that works for most members, even not everyone, has been a challenge for us. And we have had a hard time really assessing the needs, even though we found out that there was a need for trauma trainings, but what specific trainings are needed in each region, or maybe each country, or within what institutions and organizations, we are hoping to be able to have a better understanding of what the training needs are moving forward. And in terms of fostering collaborations, the co-directors of the Institute were kind enough to have a meeting with us early in the year, and we discussed a number of issues during it. But one idea was to maybe have more regular quarterly meetings with the leaders and co-directors to be able to better coordinate the work that the working groups are doing, to come up with some strategy for collaboration. And also we discussed the idea of setting some standards and measures for the work that the different groups deliver, and how that would look like if we were to do cross collaborations among the different groups, and also within each group, how we should go about setting those standards, and also discuss what funding would be available for more research, advocacy, and training in the coming year. Also, our working group, the Training and Education Working Group, the co-chairs were able to have a meeting, and we are planning hopefully a training in the coming year on focusing on the adult learning theory for the members of the Education and Training Working Group. The goal of the training would be to hopefully equip us to better advocate on be it the policy matters or being for funding for the work that we do. And so we look forward to coordinating with the Research and Policy Working Group on putting together this training. Well, as it has always been the challenge, and I know will continue to be the challenge, we do have limited resources in terms of the time that we each have within the Institute to devote to fundraising, and also just the funds that we have available for the different type of activities that we want to do are limited. I know that the directors are actively working on that, so hopefully there will be more resources available in the coming year for the activities that we have in mind. And then really the competing priorities of all of us, each member, at least in our working group, wears so many different hats in different circles, and it's really hard at times to devote time to all the activities that we are involved in. And part of our work has been to think about how we can best engage and be productive in the work of the training and education group. And again, as I mentioned, our different time zones and living in different parts of the world has been a challenge. And we just want to think about how we can best reach out to different groups, to different organizations and diverse networks. Part of the discussion in our working group was that once our trauma training module is ready, how can we make sure that we are really reaching out to those who would benefit most from the trainings and the work that the other working groups are producing, and how can we make sure that we have wide network this strategy to better reach out and invite those groups to join our network. Well, part of the challenge, as you know, is that we are representing different disciplines. This is a challenge and an opportunity, because I think in many ways could be really great and could help us in even reaching out more communities and more networks, but at the same time, how we put our material together and how we go about reaching out to different groups of providers at times could be challenging. And we also need a more active core of participants in each working group. Again, as I said, everybody is so busy, and how can we ensure that we have a solid core in each of our working groups that can be active at all times and contribute towards the goals and objectives of our group. And so for the coming year, for incoming co-chairs in the new year, we will continue to work on completing the outlines for the trauma module that you saw in the beginning, and so putting together all the outlines and continue also with recording those modules once the outlines are ready. And as I mentioned again, we are going to look into more effective ways of reaching out to providers who could benefit from what we produce, and hopefully we'll continue with quarterly meetings between the different working groups and our co-directors of the Institute. And just at the end, I want to extend a special thanks to our coordinators, Sita and Sanate. They have done an amazing job, and none of us could do this work without their organization, their assistance, and they have been wonderful to work with. As well, I want to thank the group members and also our co-directors, Dr. Henderson and Dr. Chiliza. And so thank you, everybody. Have a wonderful conference, and I hope to be able to join you in person next year. Bye for now.
Thank you, thank you. I think Mojdeh has done an amazing job with this working group. She really did, was a champion, truly. So I'd really like to say all efforts and is just owing to her. Yeah, so with this working group as a whole, I think the main focus was just on the trauma module, which was started in the year prior. So it was just having that implemented throughout this year. And one of the main challenges was just basically the fact that we are from different countries. So finding a time that works for everyone proved quite difficult. So I think looking forward, what would work is strategizing better on how we can work around that that one challenge that has been coming forward. But it's all been going good, going great. So still would appreciate any questions from anyone.
Okay, hello. Thank you very much. I'm Dave Henderson, Boston. This is great work, but I see the challenges as well as getting people together and so on. So hopefully in this meeting, there will be new volunteers and so on, and maybe there needs to be some regional meetings, same time zone and that sort of stuff, where the work, sometimes we try to get everybody together and it's really difficult, but maybe thinking about regional stuff. But I wonder, with Banga's introduction this morning, he highlighted that there are several new residency training or registrar's training programs in psychiatry on the continent. You mentioned a bunch, and we have our Liberia residents, and so I wonder if this is the group that should be pulling these folks together. And the whole, one of the things that when we thought about the Institute was to sharing of resources and curriculum and that sort of stuff, but we have a bunch of new programs on the continent that I'm sure are challenged in many ways. And then we have people here who have had training programs for decades, got a lot of stuff, a lot of resources. So I wonder if this could be maybe a subgroup could help focus and bring people together that way.
Yeah. Thank you, Dr. Henderson. Yeah, I think that's true. That could probably be done for sure. Yeah, and speaking just to last year, we did send out a survey just to see what kind of training needs are needed in each continent or each country. I mean, each country. But yeah, we did come up with a few of the needs that need to be met, while also trying to gather information on who can provide that kind of training that is available, so we can try and arrange. So that could be definitely something that we proceed on and continue on coming to the next year. Any other questions? Okay.
Okay, so our clinical care delivery work group is Dr. Lachman and Dr. Paruk, but Dr. Lachman will come up. Thank you.
We ready to load it? So good morning, and thank you. I'll present on behalf of the group and Professor Paruk, who's at the back, so we can direct questions there as well. Welcome, Saida. You'll notice our group is much smaller than many of the other work groups, and I say that every year at the conference, because it is really the clinicians that are really the elbow grease and the boots on the ground. So I'm hoping that today we can attract more to our active work group. But we do have a good kind of flavor of input. So our objectives are really to look at new ways, innovative ways of addressing clinical care and needs and concerns on the continent, given that there's such a diversity of what's on offer and the capacity that's available. And one of the really big goals that we really actively tried to court this year was to partner with existing organizations and groups, really similar to the last group, to facilitate a sharing of resources. So I think we made quite good progress given the size of the group, so I'm pleased to share with that today. So in the previous conference, we shared some information about our partnership that we had started with EMG, which is Essential Medical Guidance, which is an app that is available for free with good access across the continent and across healthcare workers, including allied professionals. And they traditionally offer the opportunity for you on your smartphone to be able to access guidelines or short videos or a little bit of algorithms, and traditionally with mainstream medicine and surgery. So they were looking for a long time, offering people in poorly resourced areas how to set a fracture, how to treat cardiac failure, and we thought we could jump on that bandwagon, which we did. And I'm pleased to report that we were able to successfully complete the one of many ideas we had, but this is the first one, and I want to acknowledge the contributors here, and I see Lishle in front of me, thank you so much, amongst others. But we were able to publish a dementia-focused podcast in partnership with EMG, and this was really our first attempt. It was a successful attempt at the platform from this clinical care work group. And so what it was a team of experts in neuropsychiatry, in geriatrics, old age, and they were able to answer simple questions in a format that would be accessible, not really pitched necessarily at a specialist level, but with specialist information. And sorry, this is not very clear, but what's really helpful about it is that EMG is able to, as part of their tech service, offer us a sense of who's accessing it, in what place, and which of the modules were kind of best ascribed to. And what you'll notice there is that actually the biggest kind of podcast that was listened to was actually the introduction, which really is an important lesson for us, because it was about people on the grassroots level, at grassroots level, seeking out basic information. across the continent, which is really not something we didn't know, but which is helpful to realize that we actually needed to be able to meet people where they're at. And if we think of task shifting on the continent, it is about healthcare providers providing the care who are not specialists. And so they're wanting that basic core evidence-based information. So we're really pleased, and thank you again to that group for the Dementia podcast. If you haven't downloaded the EMG app, please do it. It's for free, and you can find it on your Google Store and the App Store. And it's a wonderful resource, and we look forward to ideas in terms of what you would like to have us do. So our second goal was really about partnership. So I'm pleased to announce that we have an existing partnership now signed with the South African Society for Sleep Health. I don't see, is Michelle here? So Michelle Baker was really also one of the recipients on the previous conference of the kind of early career, and she presented her work for a PhD. And she's part of the South African Sleep Society. And so we have since signed an MOU with the hope on building and sharing resources. So rather than reinventing the wheel, looking at a platform that exists already. So this is really interesting for us because sleep and psychiatry, we know as clinicians, are intricately related. It made complete sense to focus on that. In fact, most people presenting with mental health conditions are presenting with problematic sleep. And so it is about screening, it is about acknowledging where the synergies lie and how can we get that good information from a sleep society that is filtered down into mental health care providers. And so we were really happy. It's the first initiative that's been to gain access to specific parts of their website and resources. So they are an organization that you pay to be part of, but have allowed us access for our members to be able to tap into those resources, which I think is a great start. The third goal that we had, which we started with our initial AGMHI clinical work group, was basically a really small group that looked at the African Association textbook. And I feel really strongly about this because it is about us providing information that originates in Africa. We were so tired of really just all the evidence coming from these weird countries and everyone packaging it into an African narrative. So we really kind of took this on full force. And when the African Association contacted us and said, would we like to update, we thought, can we rewrite? And so we rewrote just one chapter. And that was the child and adolescent psychiatric disorders. And we called it very aptly an evidence-based approach for Africa. So while we still targeted and referenced the existing evidence base, whether it was NICE guidelines or the IACAPAP or the American Association, we referenced all of that, but we said, if you were sitting in Africa, how would you approach a child who came to you with a low mood? Or if you were sitting in some rural area and you didn't have access to that second level pharmacological treatment, what should you do? If you had a behaviorally difficult child, what happened? And that is why we're very excited about this chapter, which has really had input from a small group of us in South Africa, child psychiatrist, and Yewande Oshodi from Lagos University in Nigeria. And we're very happy to say we've looked at the final proofs of it, and it looks great. And Prof. Ndete has assured us that things work slowly in Africa, so it's 3 years in the making, and it's going to be produced, published next year, so we shall share that. And then, dynamite in small packages. We have a very small group, but we think we've done a lot. And I'm very pleased to have and acknowledge Neil Horn here, who's our colleague from South Africa, now jumped ship again in that brain drain to Kenya. But we really feel strongly about partnerships. And about collaboration. And so one thing we're really excited about is Royal College of Psychiatrists in the United Kingdom. And so we have started an engagement with the African division of the Royal College, which we haven't had a great relationship with before, we'll just say, but thanks to Neil, now as a familiar face, and the dean of the college, who was actually quite open to it, I think will be here tomorrow. We were able to have a meeting with the executive committee, and a preliminary discussion is really about the common overlap of ideas. So how do we really strengthen clinical service delivery, but also overlap with education and training on the continent? So if we look at challenges, we really have been heavily reliant on South African contributors. And I'll say it without any kind of acknowledgement of bias. is I'm a child psychiatrist, so I'm going to push for child and adolescent mental health regardless. And old age psychiatry, we've also had because other members on the group have actively been involved in geriatric psychiatry, neuropsychiatry. So what we want is it's been challenging for us to get membership into this working group of people outside of these two big sections. And that's because people seem to be attracted to the research module groups and to the education and training. But I'm here to remind you, look at the progress we've made. So this is the group you want to join. And so that we can expand this clinical content, because it's really important. We can't really be setting the tone if we don't know what's needed elsewhere. I think that we have ongoing our way forward is we're going to have 2 more podcasts that are going to come up. One is going to be sleep related, and the other one we're really excited to partner with, again, infant mental health is my thing, but also maternal mental health. We're very happy to also have on our group, when she has time, Lavinia Lumu in Joburg, and she is coming in as the first Black president, Africa-based, of the incoming International Marseille Society for Perinatal Mental Health. So it's really a good idea for us to partner with her and to take this forward. And then obviously with the AGMHI, we're at the conference, we're hoping that we can cross over and have better discussions with our Royal College colleagues, especially regarding shared learning resources and how we can better be supported to produce this next best thing of evidence-based information for us. Thank you. I'll take questions.
Great. Thank you again for your great presentation. My thoughts were about should AGMHI write a book, a clinical textbook, or would you do like country to every country does their own clinical textbook or so on like.
So,
what are your thoughts about that?
my thoughts is there is an existing African textbook. That's the kind of opportune moment for us to look at what's in there and target and rewrite. Because then rewriting a single chapter is much easier than reproducing the whole book. And I think, I'm sorry Visu is not here as well today, because I think that's also one of the aims to relook at what we can offer collectively in Africa synergistically, rather than just you do your thing in East Africa and we do our things in South Africa. So I would imagine we wouldn't have time to necessarily do that, but we would have time to do chunks of it, bite-sized pieces, rather than the whole textbook. And Dave, they did give us, I mean, the Senate will back me up with this, that chapter says it's AGMHI in that African textbook. Yeah, that's the affiliation.
Hi, Christina Borba, I guess NIH now. I know this, I do have an academic appointment, yes, so Boston University. So I know this is the clinical care delivery, but I just want to say a couple of things. Sleep and youth mental health are the 2 top priority areas for NIMH right now. And so as you're thinking about building an evidence-based, I'd always keep that research hat on as well and collaborate with the other working group, because these are the 2 areas that are going to get a lot of attention in the coming years. So just for the working group as well, and for you guys, as you're thinking about building out that evidence for these 2 areas. And maternal health as well is the 3rd one. I mean, you hit the top 3 priority areas.
This is why you join our group.
Something where there's a gap, thinking of textbooks, is understanding the different cultural, multiple, diverse cultures which we encounter across Africa. And it's very hard to find any book or resource which has brought together information on the many different cultural understandings and how that affects mental health. So anyone who'd like to write a book, that's an idea.
Thank you. Thank you, Dr. Lachman and Paruk, for your leadership in that group. It's very nice to stand in this position where I've seen it develop over the last 5 years and how much growth there's really been. It's exciting and it's impressive and it's a testament to all of you in the room and beyond. Last but not least, we're going to talk a little bit about the Advocacy and Policy Work Group. Dr. Talatella and Wolthusen lead that group, and Dr. Wolthusen's here to do the presentation, I believe, right? Come on up.
All right, good afternoon, everyone. As last year, I'm sorry, I'm the last one between you and the lunch. So maybe next year we can reshuffle so there's no negative impact and bias towards our work group. We are a decently sized work group as well from across the continent. We had 3 objectives this year. First is building an advocacy database, and I'm just talking about this more in a second. The second was to prepare the adult learning theory module, which we already heard about a little bit, and then to recruit members from across the continent and beyond. So let me just dive in right away with the advocacy database. I think the idea really is that there's so much advocacy going on the continent, but that people just don't know about each other and about each other's work. And so the idea was, can we actually have a database of people who do advocacy on the continent? And not only who are they, but what are they advocating on? How long have they been around and how have they been successful, right? Because advocacy takes so many forms and shapes and sizes that we really need to learn from each other. We also wanted to know from them, what are the failures? What did you learn in the process, right? What can we learn as a whole group? And I guess this goes back to Dave's point about right, sometimes it's hard to coordinate this across the continent just because different cultures, different time zones, people have different priorities. So we did appoint different work group members to lead the advocacy database collection in different parts of the continent, and you can see the names listed here. And so big thanks to all of them. And we have received about 75 responses so far. What's really more exciting than just collecting the data is that people started to collaborate. So for example, Ghana passed a law earlier this year that decriminalized suicides, which is really good. And Kenya is still in the process of doing this. There was some recent push, but really people started then to connect. And then we had a bunch of workgroup members who started writing a paper, what can we actually learn from Ghana, how they decriminalize suicide, and what can be applied to Kenya, right, in the same context. And we actually had someone else join from other countries, from a couple of Asian countries who are in the same process, who have done some work and who are also in the process of decriminalizing suicide. So really the idea of this advocacy database is not just to have it in the form of here's a database, go look it up on Resource Hub, but really to connect people on the continent who do similar work and kind of have them connect to do some scholarly projects. Here's the QR code to the English survey. So if you want to scan it right now and put in some of the work you guys do, or you want to distribute it to some people you know, please feel free to do so. One of the challenges we encountered was the language barrier, because not everyone on the continent speaks English, right? And so I think that's one of the biggest questions we always ask ourselves as part of the work group, what do we do with countries, in terms of including them in our work group meetings, or in terms of representing them where the primary language is French or Portuguese, right? And so we actually did translate the questionnaire to Portuguese and to French and distributed this as well. But I guess the overall question is more, about the institute, who are we trying to reach and how, and if we try to reach people beyond English-speaking countries, do we need to provide information in French or Portuguese overall? I think the other question which really came up was what's incentivizing people to participate, right? Because we often see, we often ask, give me your information, and then we run away and that's it. But really the idea is well, if you contribute, you have access to the database and you can start to collaborate with other people on projects and to connect with people. The second one was the learning module, which we heard about before. It's really the idea of this like, that some of us are clinicians, some of us are like mental health providers, but really when we go to school, we mostly learn about medicine and psychiatry, right? But oftentimes what happens on the continent and beyond is that we are put in positions of power, and all of a sudden we are asked like, okay, now you do policy, right? But we never learned how to do policies. Or like we are asked to like advocate for people, but we never know how to advocate for people, right? And so we call it like a competency toolkit where we say, well, there are more competencies that we need to learn and need to like get to people that are not necessarily taught in medical schools. And so that's the idea of the competency toolkit. This is a continuation of the work from last year. And so one of the areas that was identified as helpful was the adult learning theory, which is the idea, right, when we are teaching, when we are talking to people, like how do they actually most effectively learn? But adults like learn in a particular way. And so we are currently, and this is like one of our work group members, Greg DeLarge, is like working on this primarily. But basically the idea is like we are compiling a bunch of resources in terms of adult learning theory. We have very similar discussions to the education group, right? In what kind of setting and format do we offer this? To whom is it accessible and how? But also like we want, not only to make this in a silo in our work group, but we actually reach out to the research group, for example, to say, right, you have this really nice mentor-mentee connections. Is an opportunity, right, when we are teaching the mentees, like where we can teach the mentors, first of all, about adult learning, so that they understand how to effectively teach the mentees. Or we reached out to the education work group, as was mentioned before, right, because again, if you do a trauma model, like there's one thing about the content and make it relevant and culturally relevant to the context, but also like how do you design the modules? And so can they be based on ideas of the adult learning theory? And that's why we are honing in on this particular topic as one of the competency toolkits first. Obviously we don't just want to replicate what's out there, but we really want to make it relevant. And we are like also thinking about, right, is the resource hub the right place to do it? Because there will be like asynchronous learning, and that's part of adult learning, but like, do we need more? Right? We kind of like our module should practice what we preach. And so that's like part of the discussion is how do we deliver the content? The last one is the recruitment. We did, pitch the work of the African Global Mental Health Institute at numerous conferences with very positive feedback. My overall takeaway is that the Institute's work is widely unknown, unfortunately. I think, there's like so much power of the Institute, and yet when you go to conferences like World Psychiatric Association conferences, people don't know about it at all. And I think there's like so much potential to recruit people and interested members potentially, and even to diversify the work group and the Institute. In our particular sessions, what we did, we were introducing an advocacy corner as part of our meetings. I think that's very similar to what you guys do, where people present their research. So we start off our meeting with updates about advocacy and policy stuff on the continent, right? So where we learn about what has been going on in different countries. But also I think, one of our long-term goals here really is we want to be kind of a resource for people, right? So they come, they say, we have this particular challenge in my context, in my country. Can you help me brainstorm like how best to approach it? Not necessarily solve it, right? But kind of, again, connect people and hear from each other. And so hopefully, again, this is incentive enough for people to join our work group to get advice and to also share their stories. Already talked about this, we could, when we want to kind of like recruit more diverse members, do we need to make more information available in other languages than English? And then just in terms of the way forward, we're gonna explore additional overlap between our work group and the education work group and the research work group, which we have already started. We are definitely gonna continue to use Zoom as our preferred meeting location, but also, right, Zoom has this really nice translation feature. Like, why don't we just use this if you want to include members that don't speak English, for example? And new projects, we're actually thinking about, in addition to the advocacy database, the other thing we realized is there's so much research going on the continent, funded research, NIH funded research, private funded research, but people don't know about each other. Like, Boston Medical Center has collaborations in XYZ countries. Duke University, where I'm based, has collaborations in ABC countries, right? But they never cross-talk, they never talk. And so really, it's really hard to find. I mean, you can go to the NIMH homepage and look up like who's a grantee, right? And like kind of like find out that way. But it would be so much easier, again, with the idea to connect people on the continent and to know where the money is, but also then to go the next step, right? Because research shouldn't exist in a silo, but research should be translated into meaningful policymaking. But if we don't know what the research is about, and it like kind of like is up to the investigators to translate it into meaningful political discourse, then this may be a lost opportunity, because the Institute has members from many different countries. And if the members were more connected to the research that's happening in their own countries, in their own context, and can then help to translate it into advocacy and meaningful policy, I think this would be way more impactful than just to say, we have done our research work, here's the proposal, here's the end, but that's the end. And so that's like really something you want to think about and build in the long term. Thank you.
Yeah, sure. Thanks for the talk. Does your research include advocacy on that? And do you know, for example, how many countries in Africa do disenfranchise people with mental illness, as is the case in South Africa?
Yeah, no. So currently, I would say the continent is very member-driven. In terms of like advocacy, I think this is a very important topic, which definitely could be on our agenda, but also like, for members to contribute, like they have passion projects, and unfortunately, so far, like it wasn't like one of the priority passion projects of one of the members, but here's the call to invite people to come in and expand our portfolio.
Just a comment. Thank you for a very interesting presentation. I think the advocacy and policy toolkit should be part of the curriculum for our registrars.
Yeah.
So, once it's developed, I would really encourage us to maybe share with the university heads of departments so that it can be included as part of the curriculum. Because if the young people know how to advocate and change policy, that's going to make a big difference going forward. Because otherwise they realize the weaknesses in the system, but they don't know how to address them.
Yeah, I think like the unfortunate truth is that a lot of people enter with like cognitive dissonance, burnout, moral injuries, right? Because they see the disconnect between what they're taught to do and what the ground reality looks like. I would even say, I would be more than happy to include this in any curriculum. I mean, even in the United States where I'm practicing, I'm trying to advocate for the inclusion of skills like that in the curriculum. And the standard response you get is like, well, our primary job is to make you a good clinician. True, and the reality is we are all like facing socioeconomic factors, political factors. Our patients don't exist in silos, right? They exist in the political system. So I think it's a very important skill to have. And I would even say we should be collaborating with you guys before we are done, because whatever we design and develop is depending on the user input, and there's nothing more important than designing it for the target audience. So thank you.
Hi, my name is Marlena Norris. I think that the last speaker kind of shared part of my thought. One confession before I say anything is I'm not a psychiatrist. I'm in emergency medicine in the States. I'm Donna Norris's daughter, though, who's so excited to be in this room. And I think that these ideas and these thoughts it's really nice that you guys are getting together. And one of the things that, I don't know how many people know about what you know about emergency medicine in the States, but my job is basically to meet people in their crisis and link them to all the people that they didn't know, should have known, couldn't get to. You know, the surgeon, the financial representative, the social worker, the regular doctor, primary care stuff, and start to do some education while we're running on a treadmill. So here, what I'm hearing though is how some of the things you guys are talking about is creating these same kind of linkages in a different form throughout Africa, but also throughout yourselves. When I heard from your talk about the advocacy thing, I thought of what are the things I didn't learn in medical school, you know, and how your advocacy thing may reach the research group, you know, maybe be one of their curriculum, you know, for, once or twice a year as a conversation that you guys have on some video linkages, or something that they learn or just get your module. It may be something that you guys bring to the training module group, to the schools, you know, to the programs. And I think that these are part of the toolkits that you can start to strengthen, you know, kind of the cross collaboration amongst your group, which you guys are all here, you're ready to do that, but also sort of make it kind of grown up in your foundation so that you guys each get each other's pearls. Because what I'm hearing is pearls of wisdom being shared. So I find that exciting. I just wanted to comment on that, but even bringing your modules to each other on a more frequent integrated basis, I guess.
Absolutely.
Thank you.
Yeah, thank you so much for your comment, and I full-heartedly agree that this is an effort across different work groups and also across the whole institute. And I do want to also thank, of course, the co-directors and then Zite and Senait for the support we received throughout the year and also for allowing me to co-chair the work group this year. Thank you.